This is a short video demonstrating how to perform an ultrasound guided biopsy on a chicken breast using an olive planted inside it as a target lesion. There are a variety of spring-loaded biopsy needles available, and you may find that your department stocks more than one make of differing sizes. The mechanism of a needle will be similar for the different types of needles used. For the purposes of this video, we're going to be using this 14 gauge 9cm biopsy needle. You can see there is a green plunger at the bottom of the needle, black lines across the needle shaft indicating 1cm markings to help you gauge the depth of the needle inside the tissue, and a specimen notch at the end, which we're going to take a closer look at shortly. The needle is spring-loaded, which helps provide the force to cut or trap the tissue sample in the needle. In order to load the needle, you've got to pull back on the green plunger until a firm click is felt. This needle can take either 1cm or 2cm tissue samples. Pulling back on the plunger until the first click is heard indicates a 1cm throw. Pulling back further until a second click is heard indicates a 2cm throw. You can hear the two clicks as the plunger is pulled back in the video. At this point, the stylet is retracted and the needle is ready to be inserted into the soft tissue. When the needle is in position, you need to push on the plunger until the first stop, which will advance the specimen notch into the target. Pushing firmly on the plunger until the next stop will trigger the spring to fire and close the cannula to trap the tissue in the specimen notch. This makes a further clicking noise. This close-up shows the specimen notch, which is this small dip at the end of the needle. Firmly pushing on the plunger, you can see the cannula close over the specimen notch. And at this point, the needle can be removed from the soft tissue in order to obtain the sample. To create a model to practice on, all you need is a chicken breast and olives, ideally ones with a filling. For example, these are pimento stuffed olives. And when you take a sample from the olive, you should be able to see the red pepper indicating that you took a sample from the centre of the olive. You need to either put the olive inside the chicken breast or you can just wrap the chicken around the olive. You can see here we're using our linear probe covered in plastic just to keep it clean. You can see the olive with the hypoechoic pimento centre. The needle has already been inserted on this image and you can see it on the right hand side as it is approaching the olive. You need to consider the tract of your biopsy needle, and you can see by positioning our target to the left we can see the track of the needle as it approaches the olive. Depending on the depth of the lesion and the surrounding structures that you need to avoid, you may have to insert your needle slightly further away from your probe or take a steeper angle. You may see less of the needle in the tissue before it enters the lesion. When you are ready, keep the probe steady and insert the needle into the chicken, ensuring that the needle has already been primed by pulling back on the plunger with the stylet retracted so it's ready to take a sample of the olive. You should take time to get used to adjusting the angle and depth of your needle so you're familiar with how to manoeuvre it. An important principle when first learning any ultrasound guided needle procedure is to ensure your needle is in line with the probe, as you can see in the image. This will ensure that you can see the whole length of your needle as it traverses the soft tissue towards the target. You may find this easier to practice by only looking at the needle and probe and not at the screen. If you cannot see your needle on the screen, you should not move both the probe and needle at the same time. Move one or the other to bring them in line. But bear in mind, if you're moving the probe towards the needle, you may move your target lesion off the screen and will have to readjust. Once the needle is at the edge of the target, in this case the olive, using your thumb, push on the green plunger until the first stop. You can see how the needle with the specimen notch is being advanced into the target. You may need to advance your needle slightly to ensure that the specimen notch is fully within your target. When you're ready, firmly push on the green plunger to fire the cannula over the specimen notch. To retrieve your specimen, remove the needle from the chicken and pull back on the plunger. Remember, if you used a 2cm throw, to pull back until 2 clicks are heard. Then push the green plunger until the first stop to advance the specimen notch. Be careful not to push the plunger to the second stop, otherwise you'll close the cannula over the specimen notch and you'll have to repeat the steps. You can see the olive with the red pimento centre in this specimen, indicating that we took a sample from the centre of the olive. Not all departments will have simulation models that you can practice on. However, for this particular type of procedure, you can see that you can easily create a model using chicken and olives. Hopefully you'll be able to find a time when your department's ultrasound machine is free to use and you can practice in a relaxed environment. This technique will allow you to develop your hand-eye coordination, familiarise yourself with your department's equipment, and build your confidence in performing this procedure. Importantly, this method ensures safe practice, so that the first time you're using an ultrasound machine and biopsy needle, it's not on a real patient. The principles described can also be applied to performing any ultrasound-guided needle procedure such as FNAs or injections. A key point to take away is to take your time to set up your approach and ensure your needle is in line with the probe. If you can't see your needle on the screen, don't move both the probe and needle at the same time. Thank you for watching, and I hope you enjoy olive hunting.